Hi everyone, my name is Brittany Logan. I'm one of the nurse practitioners at the Coleman Institute in Richmond, Virginia. And today I'd like to talk to you about what one of our alcohol detoxes may look like. So if a patient is interested in an alcohol detox with us, what they'll usually do is fill out a screening form that's online. And the screening form has information like past medical history, medications you're currently taking, and even some psych history. And then a provider will go over the information with you just to deem you appropriate for an alcohol detox with us. And then the night before you start, we do ask that you stop drinking at midnight, just so that when you come in the morning, we can start the medications to help prevent alcohol withdrawal seizures. So when you do come in, we'll have you come in early in the morning, usually around 8:30 that first day. And we'll have you start filling out consent forms and then bring you back as soon as possible so we can start those medications, because we don't want you to have any type of withdrawal symptoms, and hopefully not a seizure of any sort. Usually alcohol withdrawal seizures are more prevalent within the first 12 to 24 hours after stopping drinking, and that's because there's overactivity in your brain from stopping the alcohol use. So after we bring you back, we'll start an IV, we'll give you some IV fluids, and then a provider will usually come in, talk to you about our program, what medications we'll be using, and go ahead and start the medication that uses or is pretty much like a blanket over your brain to calm down those excitable neurons so that you don't have a seizure. And we'll be giving you that medication throughout the day, usually about every 45 minutes to an hour. So you are monitored very closely throughout the day. We also give a medication that helps with anxiety and also lowers your blood pressure, because what happens during an alcohol detox, your blood pressure does tend to elevate. And like I said, we are checking your vitals very frequently and can give medications as needed. And so typically the first day you are there majority of the day, because after receiving medications, we will have case management come and talk with you and try to figure out an aftercare plan. But you will leave, around 4 in the afternoon, sometimes even 4:30, and then you'll have your support person with you at home to continue giving the medications. And with the support person, we lay it out very easily. We have charts. We tell you exactly what medications to give and when to give them. And then we'll see you in the morning for that second day in clinic, so we can review, what happened overnight, as well as what we should do that day, and finish the taper of medication. And then we will see you that third and final day to continue the taper of medication, as well as if you need any other as needed medications like I talked about for anxiety and blood pressure. And then we typically here at the Coleman Institute will do some type of long-term naltrexone therapy. And the naltrexone therapy that we do is an implant. And so the implant procedure itself takes about 20 minutes. And so after we have an appointment to kind of talk about, the medications you need to continue and aftercare with case management, we'll go ahead and do the procedure. And after that, we will usually follow up with you in about 2 weeks, make sure you're doing well, and then in about a month, and then you usually are ready for your next implant in about 2 months. And the implants do last 2 months, and we really highly recommend them, as well as other medication to help deter from drinking alcohol. But overall, working a good program at the end of a detox is really important.